display a third lecture of mycology, which is entitled Dermatophytosis. Dermatophytosis is a type of fungal infection, which is later on you'll know the details of the disease. Dermatophytosis. From the name, dermato, that means it infects the superior or keratinized layers of the human body. What is dermatophytosis? It is an infection of keratinized tissues. That means any keratinized tissues, superficial tissues, or organs may be involved. That's to say, it's involved epidermis, hairs, and nails. Okay, these are the most important area that may be developed dermatophytosis, which is, the disease caused by a group of fungi referred to as dermatophytes. Hence the name dermatophytosis. Okay. The symptoms, if you remember, usually my lecture mainly consists of the first slide, definition of the disease. The title of the disease. Second one, definition of the disease. Later on, I will transfer to the details of the disease. This slide just only definitions, simple definition. Okay. The symptoms may be ranging from mild to severe, depending, of course, on the immune response of any person who developed the disease. The microorganism responsible of the disease, dermatophytes, is the agent responsible of dermatophytosis. They have no ability to invade subcutaneous or deep tissues. Neither subcutaneous or deep tissues never involves. That means it's just colonize the keratinized superficial layers, cutaneous ones. Now, we transfer to the third slide, which consists of the etiological agents. What are the etiological agents of the disease? Etiology, the causative agents, okay, which is referred to as dermatophytes. Dermatophytes is a general term, which it consists of the causative agents concerning genus and the species. Of course, dermatophytes, as I mentioned previously, have the ability to parasitize the tissues of man and animals. That means it infects both man and animals. The disease also referred to as طبعا ان شاء الله تاخذون ان شاء الله dermatology. You see that dermatophytosis, it's not common term, but the most common term is the ringworm. It's referred to as ringworm. Why it's referred to as ringworm? Okay, why it's referred to as ringworm? Because the lesion caused by dermatophytes look like worm, ringworm. حلقية تكون تشبه الحلقة الدودة الحلقية. Okay, therefore the name ringworm. Dermatophyte is a Greek word, Latin word, which is meaning ringworm. Okay, what are the causative agents responsible of the disease? We have three genuses. Just three genuses responsible, which I refer to as dermatophytes, of course. But these are genus. These are represented by epidermophytes. Epidermophytes, the first genus. Second genus, microsporum. Third genus, trichophyton. Just three genuses, but each of which consists of many species, of course. The dermatophytes divided into three groups. What are these groups? Which are referred to as anthropophilic, zoophilic, and geophilic. What's the meaning of anthropophilic? That means it's these agents, dermatophytes, which stick to the group of anthropophilic. That means it's infect. Anthro mean insan. Okay, anthro it's also Latin word. That means it's infect human only. While zoophilic, from the name, it's infect animals. But zoophilic have the ability to infect human and animal. Okay, but anthropophilic have no ability to infect animals. Geophilic, it's mean from the soil. The source of anthropophilic and zoophilic is the geophilic. That means it's present in the soil. Okay, according to their these groups divided into these three groups according to their natural habitats. Okay, واضح طلاب؟
تمام دكتورة.
Okay.
دكتور يعني هسه الجيوفيليك يعني يسوي انفكشن بالهيومنز والانيمالز غير؟
excellent excellent because هي source usually فمين يجي الهيومن او الانيمالز contact the soil okay which it's rich with this animal this microorganism this may be transferred to the human and causing the disease okay
تمام شكرا.
Okay, عفوا. And now clinical manifestations. What are the clinical manifestations? This is just general clinical manifestations. Later on, I will jump to the details of clinical manifestations. But the main clinical manifestations which are shared between, and we have different types of dermatophytosis. Later on, we will know the details, how we have these different types, okay, from according to the site of infection. Now, but they are shared in one characteristic feature that the lesion look like worm. Therefore, the name, as I mentioned above, I said it is ringworm because it's the typical lesion. It's look like worm, ringworm. It's elevated, the lesion, the periphery of the lesion elevated and inflamed, while the central area is healed. Therefore, it's look like the worm. Okay, let us know the details of the disease. Here we have different types of diseases according to the site of infection. Put in your mind, as I mentioned previously, put in your mind any disease, fungal disease in particular, have many names. In the beginning, I said it's dermatophytosis. It's also referred to as ringworm. It's also referred to as tinea. Tinea, it's Latin word, okay? It's mean worm. It's a Latin word. It's mean worm, okay? What is the first tinea pedis? From the name tinea pedis, tinea pedis is Latin word. Completely, it's Latin word. Pedis from food. It's mean food, okay? It's also referred to as athlete's food. Why it's referred to as athlete's food? Let us know the details. Okay. Infection here occur mainly in the interdigital webs and the soles of the foot, mainly in those individuals who wearing shoes for long period of time. Athletes, for example, soldiers, okay? Therefore, the name athletes foot. Mainly, it's athletes because they are wearing shoes for long period of time, and this microorganism mainly colonize this area, maybe from Earth, wherever, colonize the interdigital webs. And when there is humidity, darkness, there is flourishing of the microorganism causing the symptoms. Mainly it's affect the tie webs. Do you know? Okay, الأصابع القدم بيناتهم الويبس اللي هاي يسموها الصفاقيات بين الويبس. Okay, التايز. Okay, scaling. It's the main symptoms the patient suffering from. What are these symptoms? Scaling, fissuring, maceration, and erythema. Please, any strange word, please ask me about the terms. Okay. Now, this is the symptoms associated with what? Itching and burning sensation. It's the patient feel discomfort because the itching and burning sensation, the main symptoms that the patient develop. If there is bacterial superimposed, this is the disaster because the erythema will increase, edema occurred, more pain, okay? Tinea pedis mainly have an acute onset with inflammation. Sometimes it develops vesicles, sometimes pustules, okay? That means it's when it's macerated, postulated, this is produced serum, look like serum, okay? Discharge. The major causative agent of tinea pedis. What is the major causative agent of tinea pedis? Is epidermophyton. If you remember, we said previously 3 genuses: epidermophyton, microsporum, and trichophyton. Epidermophyton flucosum, it is the major species responsible of tinea pedis. Okay. Let us go to the second disease. طبعا in dermatology شوفون طبعا اكو there is good or big relationship between mycology and dermatology. Hence there is also a good relationship between mycology and medicine, but mainly هاي طبعا later on you in dermatology session ان شاء الله تشوفوها بس الخامس ان شاء الله you will see these diseases, and particularly tinea. Tinea capitis. Tinea capitis is also Greek word, which it's mean infection of capitis, scalp. Okay, tinea, that's mean infection of the scalp. What are the microorganisms? I mean, dermatophytes responsible for tinea capitis are microsporum. Remember, epidermophyton, microsporum, trichophyton. These three genuses. But as I mentioned previously, each of which consists of different species. Now, tinea capitis responsible for this disease, whom? Microsporum canis. Canis, it means a source, it's zoophilic, because canis, it means dogs. Okay?
شو دكتور العفو ممكن تعيديها؟
Microsporum canis. Canis, the source, it is zoophilic. من canis, it's mean dogs. كلمة كان إذا سامعين canine من كانوا بالتفتيش يقولون canine. Canine, it's mean canine طبعا هي بس مختصريها. Canine, it's mean canis. Canis dogs. It's mean dogs. Okay? وياي يا طلاب؟
تمام دكتور.
اوكي. هو بس انت طبعا الوحيد يمكن بدها تحضر المحاضره anyhow ما ادري يجوز اكو حاضرين بس مسويها ميوت anyhow. Now, Microsporum odoinii, this is anthropophilic, just for human. Trichophyton, also another genus. شوفوا عندنا Microsporum odoinii, Microsporum canis, this is belong Microsporum. Trichophyton, this is the third genus اللي mentioned in the previous slide, okay? These have the ability to invade hair shaft. That means the scalp and hair shaft involved. Not only the scalp, hair shaft and the scalp. Okay. We have here two terms where in tinea capitis. The first referred to as endothrix and the second one referred to as ectothrix. From the name endo. Endo, it means endo, inside. What is the meaning of endothrix? That means the fungi have the ability to invade the hair shaft from inside. Okay, endothrix. While ectothrix, no, not invade the hair shaft, but it's grow above the hair shaft. From the name endothrix, ectothrix. Okay, here the sometimes the when the fungi invade the endothrix, invade the hair shaft, causing endothrix, the microorganism of course propagated, and the hair follicle will be burst, and the spores of the fungi will cover the hair shaft. Okay. Of course, the infected hair appears dull gray. بين رصاصي معتم. Okay, dull gray. يعني not give the true color of the hair. Whatever it's blackish, brownish, yellowish. Okay, it's appear dull gray. Some hair broken off and a few millimeters above the follicle orifice. اوكي يعني الهير شافت تصير بيها broken. اوكي فيبقى بس الهير orifice appear just above the scalp, creating appearance of partial alopecia. What's the meaning of alopecia? طبعا ايضا if you know it or later on will know it, alopecia يسموه داء الثعلبة in Arabic. Okay, تجيكم هاي كلها بالdermatology, you will see it إن شاء الله. What is the causative agent of ectothrix and endothrix? And for example, Trichophyton tonsurans. Trichophyton tonsurans, one of the species responsible for both ectothrix and endothrix. This picture, if you see the picture, this is just look like alopecia. طبعا alopecia من يصير عند البيشنت يعني يكون هيجي يعني يكون hairless area. Okay, this is dermatophyte infection. This is tinea capitis, not alopecia. Therefore, the differential diagnosis is mainly confused with alopecia. Tinea capitis. This is alopecia. Tinea capitis, as you see here. Okay. There is a term, وهذا very important term. Later on, you will know it. You will know it, inshallah, in dermatology also. It's referred to as carrion. What is carrion? It's referred to as honeycomb. Honeycomb, it's mean شلون خلية النحل. Okay. The hair infected hair appears look like honeycomb. How? The pustular folliculitis of adjacent hair follicles with pus. يعني عندنا شلون الهير كأنما يعني عشان يعني ما اريد اشبهه هو بالعسل او فشي يعني adjacent hair follicle adjacent with each other وcovered with pustules. Okay, pus and crusting. Pus and crustings. بيها few scales, crustings of the infected scalp. So this is the area appears look like a honeycomb. This is a characteristic feature of the tinea capitis. Of course, not all patients develop kirin, but some of them develop depending on the species that develop this. Not all the species. Trichophyton, one of the species of trichophyton causing this phenomenon. This is طبعا high from above. Okay, this is the postulated, as you see, this is the carrion. شوفوا طبعا هي ما تبين هنا لانه هاي from above magnified area بس طبعا من when you use magnifier it appears very clearly. This is from the above postulated area of tinea capitis. This is very typical. شوفوا typical هنا شلون adjacent hair shaft covered with pus. This is carrion. This is typical carrion. هاي طبعا clear more than the previous one. Okay, this is شلون شوفوا adjacent hair covered with pus. This is the carrion. This is carrion. This is somebody may be asking. This is also postulated. I mean carrion. Okay, somebody asked me why it's greenish or yellowish. There is a tool, dermatologists use it in the private clinic, referred to as wood slump. Later on, we'll be in diagnosis. I give you the details. Wood slump, woods. It's mean wood. يعني غابة. It's woods. According to the first clinician, woods will be ownership S يعني S التملك. Woods. طبعا لسه شو قلت لكم موجودة باللاب diagnosis إن شاء الله. Woods, the first clinician who discovered the apparatus or tool that it's the principle of طبعا هاي tool used in the diagnosis. The principle of its work, it's using UV light when it's focused on the infected area, I mean tinea capitis. According to the pigment produced by the fungi, it's reflect color, whatever the color. Some of them greenish, some of them whitish, some of them yellowish, oranges, depending on the species of fungi that produce special pigment. Wood slump. Okay. Now, if you remember, I said previously there is trichophyton. This is T, trichophyton. This means T. There is a species referred to as trichophyton shonellinii. Very complex for you. I chose just only the most common species. If you remember, I said I chose just the selective, the common species. I discard the others. Okay. Trichophyton shonellinii. This is caused a phenomenon referred to as favose or favos. Then this will be, inshallah, you will see it in dermatology, okay? Favose or favos, which it's postulated also, but the pus usually covered also the follicles. It's look like a crust, look like a cup, كأنما cup تشبه الكبات. طبعا this is under magnifier. This is the crust or cup-shaped pus, which it's later on this pus will be crusted, okay? These crusted refer to as scutula. Scutula, that means it's look like a cup which is covered the hair shaft, along the hair shaft. This is referred to as favose or favos, caused by trichophyton shonellinii. This is the most. These are the most important terms: favose, carrion, and tinea capitis. These are the most important terms that you should know, and in the future will know the details, inshallah. شوفوها طبعا whitish according to the pigment قلنا الwood slump according to the pigment produced by fungi when it's focused by the UV light. I mean UV wood slump. This is another picture of catinia capitis and the different. شوفوها طبعا according, some of them mild. If you remember, I said mild, severe. This is severe, of course. These are severe tinea capitis. Now we turn to the third type of tinea, which is the tinea barbie. Also, come on, all tinias are Greek words, Latin words. What's the meaning of tinea? Barbie, it means Barbie from barbers. It's shaver, يعني الحلاق. Barbie. Why it's Barbie? Because it's bearded area, يعني منطقة اللحية عند المale, sorry, ringworm of bearded area of men, Barbie, because it's mainly shape, referred to as Barbie. Okay. The causative agent responsible of tinea barbie are microsporum and trichophyton. شوفوا هنا epidermophyton just cause tinea pedis, have no ability to invade skin. Okay, hair shaft, just the skin causing tinea pedis. Here, microsporum trichophyton mainly responsible for the other entities. Okay. But tinea pedis also may be caused by microsporum trichophyton, but the major cause is epidermophyton flucosum, as I mentioned in the previous slide. What are the characteristic features, or sign symptoms of tinea barbie? The area mainly, the bearded area, erythematous with patches, erythematous patches on the face, sometimes also the neck, the bearded area, neck and face, show scaling, fragile nostril hairs. was mean of the nostril hairs? It's mean يعني فاقد اللمعان, fragile, delicate, easily to broken off, okay, and have a tendency to of folliculitis. Folliculitis just look like acne, يعني حبوب صغار, folliculitis. These are the major symptoms of tinea barbie. This is as you see here. شوفوا طبعا هنا شلون كأنه مارين worm. هنا طبعا بعدين هم نشوف typical picture ان شاء الله. هاي كأنه ما شوف الحافة شلون تكون. Okay, this is the tinea barbie face. This is the chin and this is the neck. Mainly tinea barbie of bearded area. Now we turn to the fourth, which is the most common tinea among the others. Sorry. Which is referred to as tinea corporis. Tinea corporis is also referred to as tinea cersinata. Some of them say tinea corporis, tinea cersinata, whatever, okay? Both of them are Latin words, as I mentioned. Now, the infection mainly where it's occurred in the body, any part of the face, sometimes face of female, even boys, even males, but not bearded area, above, okay? Wherever may be involved, any part of the glabrous skin. That means the infection occurred in the glabrous skin. What's the meaning of glabrous? Glabrous, it's mean hairless area, devoid from hair. Okay. The lesion, typical lesion, as I mentioned, it's look like annular in shape. That means it is worm-like, okay, with a sharply outlined margin, okay, and it's inflamed with central healing. Some of cases which it's highly infected one, the severe one, sometimes it's postulated, vasculated, okay, with erythema. Here, when I said glabrous skin, it's being hairless, as I mentioned, hairless area. In comparison with hairy area, scalp, bearded area, but put in your mind, there is no complete hairless area. The skin of male, female, even children, there is hair, but it's tiny hair in comparison with hairy area. Sometimes folliculitis associated with the skin infection of the glabrous skin. Any hair follicle, okay, of the skin may be involved, and this is maybe go deep and deep, not just in tinea corporis, even in tinea capitus also, or tinea barbie also. It's involved. Hair follicle. طلاب
الكرويات موجودين.
بدي اسمع واحد بده يتجاوب، ما اعرف يعني anyhow يعني خاف قلتنا عشو الدنيا الصبح المفروض شبعانين نوم. Okay, here the hair shaft may be involved, okay, and with the hair follicles, and this is maybe reach the dermal layer. If you remember, I said in the previous slide, the first or second slide, I said dermatophytes have no ability to invade subcutaneous and dermal layer, just cutaneous, okay? But in some cases, when hair follicle involved, maybe reach the dermal layer, causing dermal inflammatory reaction. And this is referred to as Majushi's granuloma, forming granulomatous reaction, referred to as Majushi's, according to the first clinician who diagnosed or defined this granuloma. This is mainly occurred in the tinea capitus, in tinea barbie. It's mainly, as you know, hairy area. The area, it's subcutaneous. Mainly, it's occurred subcutaneously, not in cutaneous, subcutaneous, and opened to the skin. This is Majushi's granuloma. That means it is tinea corporis or tinea pedis, tinea capitis, tinea barbie, but it's involved dermal layer, not just cutaneous, dermal layer, and open to the skin. This is Majushi's granuloma. This is tinea, tinea corporis, infection of the arm or leg. I don't know what is this area. Okay, whatever. Yeah, that means glabrous skin. But this is severe, not mild, because it's postulated, as you see here, postulated vasculitis or okay, erythematous. Here, this is tinea corporis. So this is typical. This is typical ringworm. This is mild. Why mild? Because it's not vasculated, not postulated. Okay, as you see here, this is mild. Look like ringworm, as you see, inflamed borderlines or periphery with central healing. This is the typical mild tinea corporis because this is the arm of one patient. Now, chineokuru, another fifth type of tinea, which is chineokuru. What is chineokuru? Chineokuru, it means the infection of the groin, which is mainly groin, you know the groin, okay, which is mainly common in men more than female, but this is also infect male, female and male, but mainly occurred in males more than females, which is also involved the perineum area, scrotum of males, perianal area also may be involved. That means the sexual organs may be involved, okay? The crurus. Also, it's also occurred in other area, not just in the these areas. I mean the groin. It's also maybe occurred in the under breast, under pendulous breast. يعني الصدر الكبير دول الفيميلز الاوبيز elderly because طبعا low hygienic conditions دول طبعا تعرف elderly why I said elderly دول يصير عندهم low hygienic conditions maybe يعني not washing area فطبعا wetty area because it's prefer flourishing the growth of fungi. Okay, under pendulous breast in the axilla also around the umbilicus also of obese women. These are developed also, which is belong the entity of tinea crurus. What is the characteristic symptoms of the disease? Erythematous, mainly erythematous. Okay, sometimes associated with vesicles, itching, burning sensation. Okay, with chronicity, sometimes it's chronic because this is acute. I mean, erythema, vesicles, itching, burning sensation. This is acute. When it's turned to chronic, it will be develop hyperpigmentation with less erythema. What's the meaning of hyperpigmentation? طبعا اعطيكم فد example وهذا ان شاء الله also تاخذوه بالدرماتولوجي يسموه a term referred to as post-inflammatory hyperpigmentation. Post-inflammatory PIH. what's the meaning of this term? اذا انتم طبعا انتم شباب ومثل تطلع لكم حبايه for example الحبايه within the time طبعا بالبدايه تكون reddish inflamed or erythematous. Within the time it's convert to brownish in color. This is referred to as hyperpigmentation, post-inflammatory hyperpigmentation. So any chronicity, it's convert from erythematous reddish to brownish one. Therefore, it is hyperpigmented one with a less erythematous. Of course, chronicity less symptomatic in comparison with acute one. This is as you see here. طبعا هنا المنطقة في هذه هذا البيشنت because it's يعني ما بين الجروين area sorry, but it's extend to the thigh and تشوفوها طبعا هي brownish in color. Now, the sixth type of tinea, which is referred to as tinea anguum. Anguum term, Latin term, it's mean nail. Anguum, it's mean nail. Okay. It is the ringworm of the nails. Okay. There is a general term وهذا طبعا حيمشي عليكم أيضا بالمستقبل كله إن شاء الله بالميديسين بالدرماتولوجي whatever, referred to as onychomycosis. What's the meaning of onychomycosis? Onychomycosis is mean infection of the nail. This is a general term caused by different entities, idiopathic, bacterial, fungal, viral, whatever. Okay, this is onychomycosis. But when I said tinea anguum, it is sticky for dermatophyte, but I can say onychomycosis. But tinea anguum is more precise for tinea. Infection occurred mainly under the leading edge of the nail. يعني جوا الحافة مالت الnail mainly start from this area or along the lateral borders. تمتد للlateral borders of the nails and may continue to cover the entire nail and even its beds. يعني the entire nail and even its bed. What is the symptoms of the disease? it is the we can see accumulation of the subungual debris, accumulation of some يعني يكون thick, nail thick, because the accumulation of subungual debris, and it's appear opaque يعني مؤتم, chalky, tabashiri, or sometimes yellowish, even yellowish in color, with the of course thickness of the nail white thickness, because this accumulation of subungual debris. This is onychomycosis or tinea angium, as you see here. Okay, this is deformed because this is the nail infect with the dermatophytes. We turn to the differential. Any question, Talab? If you have a question about the previous slides? No question? Okay. If you hear or not, I don't know. Okay, now differential diagnosis. What is differential diagnosis of the disease? Okay, here, when there is infection of the scalp, I mean tinea capitis or bearded area or glandulous skin, this is mainly mimic a disease referred to as staphylococcus eczema or folliculitis. Staphylococcus, you know Staphylococcus aureus in particular, of course, this is the major species and the malignant species among the other Staph aureus, mainly causing a disease eczema or folliculitis, okay, which is here, it's a type of infection of the hair, scalp of the of the head, sometimes bearded area, I mean folliculitis, also causing folliculitis, okay. This is mimic Staph aureus. I mean, tinea capitis, tinea barbie, tinea cersinata. Now we turn to the Mycology's granuloma. What is Mycology's granuloma? Mycology's granuloma, if you remember, we said that folliculitis of when the infection of tinea, I mean dermatophytes, reach the hair follicles. This is reach the dermal layer, causing Mycology's granuloma. And carrion, اللي قلنا الكريون اللي هي الهونeycomb, this is also resemble also eczema. So also eczema by staph. Mycology's granuloma also may be confused with another disease referred to as blastomycosis. What is blastomycosis? It is a fungal disease. Inshallah في أحد المحاضرات we will take the blastomycosis. It's fungal disease. The lesion by blastomycosis just look like Mycology's granuloma. Also, it may be, Mycology's granuloma may be confused with cutaneous leishmaniasis. What is leishmaniasis? إذا سامعين بحبة بغداد, cutaneous leishmaniasis also may be resemble Mycology's granuloma. Now, tinea corporis, corporis or cersinata, اللي هي infection of the glabrous skin, also may be resemble psoriasis. Psoriasis اللي هو داء الصدفية. Psoriasis is to resemble tinea corporis. Okay. Tinea cruris, which is the infection of the groin, if you remember, inguinal area, cruris. It's similar to another disease, which is another fungal disease, Candida. Candida, later on, we will know what is Candida. Not today, of course. It is a special entity or independent entity of fungal infection, Candida. It's causing also a similar symptoms to tinea cruris. What is these symptoms referred to as? Interpterygo. Candida interpterygo. That means it's causing a symptoms of inguinal area caused by Candida, just resemble tinea cruris. Also, there is another disease may be confused with tinea cruris, which is the erythrasma. Erythrasma, it's a disease caused by Corynebacterium. Corynebacterium, you have this bacteria, of course. Maybe later on you'll have it. I don't know. This is also resemble cruris, in particularly erythrasma disease is referred to as erythrasma, causing by Corynebacteria, in particularly in the inguinal area, in particularly in the axilla. Okay, and also tinea cruris may be resemble contact dermatitis. Contact dermatitis, I think you have it in immunology with hypersensitivity type 1, I think. Okay, the type of dermatitis. Okay, referred to as contact dermatitis. Tinea capitis, if you remember, I said tinea capitis may be confused with alopecia. شوفتكم الصورة بالبداية. Okay, alopecia. Tinea capitis also may be confused with a disease referred to as trichophyton. trichophyton هذا تاخذه بالسايكاتري إن شاء الله. Okay, الترايكوتيلومانيا it's a psychological disease. البيشنت عنده فد psychological problem، يعني مو معناه هو هي سايكو يعني، بس هو فد يعني simple psychological problem، يعني عنده فد السهوله احنا شو نقول يشلع الشعر، اوكي، بس هو ما يحس على نفسه. therefore this is sometimes فتصير المنطقه يعني divided from here، فتينيا capitus اللي هي mild mainly confused with trichotillomania. tinea angium قلنا اللي هي infection of the nail onychomycosis. This is also maybe confused with another type of onychomycosis. If you remember, I said onychomycosis, it's a general term caused by different entities. This is maybe confused with tinea angium caused by tinea. Now, there is a term referred to as onychogriposis or onychogriposis or griposis. هاي شنو يصير؟ الاظفر يعني ينمو يصير كبير وشون المخلب يعني ينعقد يعني، اوكي. This is the meaning of onychogriposis or onychogriposis. يسموه griposis the same. It's a hypertrophy that may be produced nails resembling clothes يعني مخلب، اوكي. or ram's horns يعني هذا الهورن القرن مالت الخروف، اوكي، فيشبهه يعني يصير هوني look like horny clothes. هذا طبعا تشوفوها بالمستقبل هاي بالدرماتولوجي، هاي كلها خلينا نقول preliminary lectures to dermatology ان شاء الله اللي تاخذوها بصف خامس، اوكي. فيكون الاظفر يشبه الكلوز or ram's horn, okay, which is this is referred to as onychogriposis or onychogriposis. The tinea angium also may be confused with onychogriposis. Okay, these are the mimicry diseases that may be confused with the different types of tinea. This is طبعا هاي بشوفكم هاي onychomycosis. This is a picture of which is confused sometimes with onychomycosis or tinea angium. بتشوفون طلاب ما ادري كيفكم. Now we turn to the therapy. Okay, how we can treat tinea in its all types of diseases or entities, starting with topical therapy. Of course, put in your mind that because it's superficial, topical may be beneficial. Sometimes topical, sometimes it's needed systemic, depends, sometimes even cortisol, okay? So depending on the type of the lesion, whatever it is, mild, severe, of course, each of which needs special type of treatment. Topical therapy may be appropriate for tinea pedis, chineokuru, and may localize also non-inflammatory. شوفوا non-inflammatory اكو double A اكو غلط بالطبع، okay. Non-inflammatory lesions of tinea corporis. Okay, this topical therapy may be beneficial. What are these types of topical therapies? Azole. It's a group of antifungal. Azole طبعا هي الازول it's a derivative. عندنا اتراكونازول كيتوكونازول، احنا اخذنا بالبريفيوس لكتشر two names of اخذنا اتراكونازول and ketoconazole. Azole derivatives which are antifungal derivatives may be effective in such entities. I mean topical can be used topically. There is an ointment referred to as Whitefields who according to the first also clinician who discovered or maybe pharmacist, I don't know the details of this scientist who discovered this formula which is the Whitefields ointment. فهو اسم من يشوفون ownership S that mean S التملك. This is mean it's a name, okay. Whitefield ointment. What are the constituent of Whitefields? Is benzoic acid and salicylic acid. These are the most important constituent. This helpful in what? In reducing the thickness of hyperkeratotic lesions of the soles. If you remember in tinea طبعا pedis, we have two types of tinea pedis, either fissured, macerated, and particularly between the tie webs, okay, of the foot, or sometimes the sole of foot may be involved. If the sole of foot involved, this will be hyperkeratotic. Many layers or keratinized layers cover the sole. Okay, how we can treat it? By using Whitefield ointment. The purpose of using this ointment, to reduce hyperkeratosis. Okay, this is the idea. But in case of tinea pedis, macerated area, macerated between ties, okay, or tie webs, okay, here we cannot use Whitefield because here this is will increase the symptoms. حاسه وتحفر لانه اوكي هناك اللي تخفف الهايبركيراتوسيس. هنا اذا هي macerated, can I use Whitefield? Of course not, because it will be salicylic acid, benzoic acid will be dekeratinize the area. So we cannot use it in macerated area, just in hyperkeratosis, keratotic area. Okay. Now, powder formulation in tinea pedis, powder formulation in moisty area, we can use it. When here moisty, we should use dry formula. Powder formulation beneficial in macerated wasty tie webs, okay, of azoles, of course. Here, in case of tinea capitis, it's required for up to 6 weeks of griseofulvin tablets. Griseofulvin, in the first lecture we have griseofulvin. It is a product of fungi. Medical importance of fungi. Griseofulvin is very important antifungal, which is produced by fungi themselves. Okay, can be used tablets, yani systemic here in case tinea capitis, and particularly in severe cases. There is another formula which is referred to as terbinafine, which is also beneficial in tinea capitis. Alternative, we can use it instead of griseofulvin. Now, therapy of tinea angium. Angium, it's very disappointing one because it's need long period of treatment. Infection of the nail is very complicated. Okay, it's need long because it's keratinized. So invasion of the drug not easy. Okay, therefore it's need a long period of time. It's need griseofulvin, but for long period of time. Okay, and because it's the griseofulvin, it's not cheap, it is expensive. In case of fingernails, it's need 3 to 6 months, up to 3 to 6 months. يعني نص سنة, while in toenails it's need 6 up to 1 year, 6 months up to 1 year. It's so long period of time. Okay, and this is here the problem. Now, how we can diagnose tinea? Of course, depending here on the site. Each entity needs a special technique for diagnosis, of course. Put in your mind that wood slump. If you remember wood slump, I mentioned in the previous in the group of tinea capitis, if you remember, which is the UV light. Wood slump is the major diagnostic tool, and particularly in the dermatology private clinic, can be used for the diagnosis. If it is not easy to diagnose by the dermatologist, he must send the sample to the lab. How we can diagnose the sample? Okay, of course, it's need depending on the site of infection I mentioned. For example, in case of tinea capitis. Tinea capitis, patient suffering from tinea capitis. How can I diagnose the case? Of course, in the first step, I should take hair shaft from the root, put it on a slide with 1 drop of KOH, 10% KOH, 10% KOH. What is the purpose of using KOH? KOH is dekeratinizing agent. Dekeratinizing agent, okay? 10% is enough to dekeratinize the hair shaft. Of course, we should use Parker ink. What's the meaning of Parker? Parker, it's mean حبر. الحبر اللي كانوا أبهاتنا يستخدمون الحبر بوقتهم. الحبر وإذا شايفين بالأفلام بال 16th century أو 17th centuries كانوا يستخدمون الريشة شلون يغمزوها بالحبر. This is طبعا we have different colors, reddish, blackish, navy, whatever, bluish in color, different colors. We can use these drop of Parker ink with KOH, put on a slide. Okay, this is for visualization. I mean color, just colorization. Okay, now a drop of 10% KOH, drop of Parker ink, put cover slip for above the hair shaft and this mixture, and gentle gentle heating حتى شنو for further dekeratinization. Then examination under the microscope. If we see spores, hyphae, I can say there is infection. But of course, this is need confirmative test, culture method for the diagnosis. Later on, we will know the culture, how we can cultivate the sample. Now, in case of, for example, tinea angium, infection of the nail. The same, we take by nail clipper يعني المقراضة طبعا should be sterilized because the disease contagious from patient to patient. Take small part of the nail, just a small part, put it on a slide. Here we can use also KOH, but the concentration of KOH here should be increased, not 10%, 30%. Why 30%? Because more dekeratinized nail, more dekeratinized in comparison with hair and the skin, of course, okay? And put also 1 drop of parkering, cover slip, gentle heating, and examination under the microscope. In case of tinea corporis or cersinata, infection of the skin, for example, how can I deal with, how can I diagnose it? Of course, in the first step, we should wash the infected area with tap water in order to eliminate any contaminant agent, okay? Then rubbing with 70% alcohol to complete vanishing, okay, the area. Then by 2 slides, the first slide by doing the secumation, that means scraping or scrubbing the periphery. We take the sample from the periphery. Why periphery? If you remember, I said the periphery is infected while the center is healed. It's not, it's useless here. Okay, we should take the sample from the periphery by scraping of the infected area, taking these few scales, put it on a slide. Here, also the same 10% KOH, Parker ink, cover slip, gentle heating, and examination under the microscope. These are the most important diagnosis of the, direct examination. We turn to the culture, the same specimens, take another hair shaft, taking another desquamation or scraping of the infected skin, taking small part of the nail, the same, okay, place them in media, which is mainly the sabrot agar, which should be contain antibiotic. Why antibiotic? طبعا هي الانتيبيوتيك cyclohexamide and chloramphenicol in order to kill any contaminant agent. You know, skin and superior layers of the body mainly contaminated. Even we, except of course the skin because we wash it and rub it with 70% alcohol. But just still, we should put maybe contamination from the air when we cultivate the sample. We should incorporate cyclohexamide and chloramphenicol in the media in order to get rid the contaminant bacteria or even undesirable fungi, contaminant fungi. Incubation of culture at 25 up to 30 degrees centigrade. Why this low temperature? Because fungi live superiorly. It's preferred low temperature, at least 4 up to 5, 7, at least 4, yes, up to 4 weeks, 2 up to 4 weeks. 2 up to 4 weeks. It's need long period of time because the growth of dermatophytes is slowly. I think this is a soul of food. You see here hyperkeratosis. Hyperkeratosis, okay, this is thick because it's scaled area, because this is tinea, of course, tinea pedis. Okay, this is tinea typical, tinea corporis or tinea cersinata, cover all the body. Face, طبعا face sometimes is referred to as tinea facialis or still tinea corporis, the same. Okay, هذا covered with يعني عنده the problem diabetic or whatever, this patient may develop this or maybe عنده the problem, okay, develop immunological problem, he developed this whole type or whole, sorry, covering confluent, lesions of tinea corporis, okay. This is another one. This is typical facialis, tinea facialis or tinea corporis, the same. This is another type of tinea. Okay, this is different culture of the microorganism. Later on you'll see it in practical parts. This is another type. This is severe, okay, tinea capitus. This is another type. My picture of the causative agent, just pictures, okay. Tinea